Hi, everybody. I'm just going to let everybody get into the room. All right, I'm going to give it till about 5 after and let everybody in. People are still coming in, I see. So, yeah, I'll give it another 2 minutes. All right, well, I'm going to start off. I know people will be coming in as we go, but I'll just do a couple of housekeeping rules. If you have any questions during this webinar, there is a Q&A feature on the bottom. I think it's on the bottom of everybody's. And you just hit on that and put in your question there. If you do put it in the chat room, we will try to get to it as well. But I just want to welcome everybody. This is Rare Disease Government Advocating 101. We're going to kind of get into a little bit more of how everybody can be involved in advocating. You can even do it from your house. You can do it, through emails, through phone calls, and we will just touch on all of that as well. If we go on to the next slide, I'll just go on to there. We'll just go over the agenda really quickly as well. I'm your moderator. My name is Frank Rivera. I run two organizations. One is called Stronger Than Sarcoidosis. The other is Sarcoidosis of Long Island. And we will have speakers will be Katelyn Laws from RDLA. We have Sarah Tompkins, and we have Sarita Edwards. We have Taylor Kane, Ella Bellassa. And then at the end, we will have about 25 to 30 minutes that try to get to all your questions. So we probably won't get to your questions till the end. I just want to let you guys know. So please don't be afraid to put any questions in. And if we can get to them, we will definitely, I'll try to ask as many questions as I can. All right, so I'm actually going to just really kick it right off. We're going to go right to Katelyn Laws from RDLA.
Awesome. Thank you, Frank. Hi, everybody. My name is Katelyn. I'm the RDLA program manager at the EveryLife Foundation. You can go to the next slide, please. Here is my agenda. I'm going to tell you a little bit about the EveryLife Foundation and RDLA. We'll talk a little bit about the power of patient advocacy, how you can get involved, and different resources that we offer. So a little bit about us. The EveryLife Foundation is a 501c3 nonprofit. We are a nonpartisan organization, and we are dedicated to empowering the rare disease patient community to advocate for impactful science-driven legislation and policy that advances the equitable development of and access to life-saving diagnoses, treatments, and cures. One quote that I think really encompasses what we do is this quote from our executive director. She said, "We do not speak for patients. We provide the training, education, resources, and opportunities to make their voices heard. By activating the patient advocate, we can change public policy and save lives." So Rare Disease Legislative Advocates, or RDLA, is a program of the EveryLife Foundation. We exist to educate advocates about how legislation and policy impacts the availability and access to treatments. And we do our best to provide advocates with all of the resources that you all will need. We also work to build awareness on Capitol Hill and ensure that Congress hears directly from the rare disease community. It's our goal to connect every member of Congress with a rare disease advocate. So when they are considering legislation, it's not about just treating a disease. They're thinking of a person that they know and thinking of the connection that they've built with you. So I'm going to talk a little bit more about that, the power of patient advocacy. So grassroots advocacy is so powerful. Legislation and public policy really do impact science, the drug development process, and access to treatments. And you have the power to affect change in all of those different sections. So I'm going to talk to you a little bit more about how to take an active role in the political process. This can mean meeting with your member of Congress, showing up to town halls, emailing, calling their office, and doing so gives you an influence on legislation and policy. Again, your advocacy matters. Your legislators want to hear from you. They exist to serve you. You are the constituent, and you are the expert on your rare disease and your experience. So it's very important that they hear from you firsthand about any decisions they would make that impact the rare disease community. When you look at this chart here, you can see why these relationships with your member of Congress matter. This was done by the Congressional Management Foundation, and it shows different reasons why a member of Congress may vote in favor of something. And the number one reason is in-person visits from their constituents. You know, with COVID, that's hard, so we've been virtual. But don't worry, because contacts from constituents is a very close second there, followed by all different kinds of things you can do: individual letters, emails, phone calls, town hall comments, all the way down to postcards and faxes. If you still have a fax machine and you want to fax your member of Congress, that also has an influence. So this just goes to show all of the different things you can do and how much your voice and your advocacy really do matter. Social media is also a very powerful advocacy tool. It's a great tool to make your member aware of the problems that you face on a day-to-day basis, but also to thank them for the actions that they have taken. So if you meet with your member of Congress, it's always a great touch to make a post thanking them for meeting with you, thanking them for any actions they may have taken in the past, or a post thanking them for any actions they take as a result of their meeting with you. And tagging them in the photos that you took at the meeting. They love the attention. They love being recognized for their work. So this is a really great way to also connect with your member of Congress. So how to get involved. I'm going to talk to you about a few different options that RDLA offers for advocates to get involved. All of the things that I'm going to mention do not require any previous experience. These are events for advocates on all levels of experience. We welcome everyone to join us. So the first event that I'm going to talk about is Rare Across America. I'm just going to give you a brief synopsis here, and then we'll get into it more in the following slides. But the last Rare Across America that we had, more than 600 advocates from 48 states plus DC and Puerto Rico met with their member of Congress. We're opening this event, registration for this event again in May. So stay on the lookout for that. Again, I'm going to share a little bit more with you about what Rare Across America is in just a second. We also offer Rare Disease Week on Capitol Hill. We just wrapped this up at the end of February, beginning of March, and advocates from 49 states, plus DC, the US Virgin Islands, and Puerto Rico met with their members of Congress. We also host a two-day legislative conference, documentary screening, a caucus briefing, and so many more events you can get involved with during Rare Disease Week. And then we also have a special program for our young adults, ages 16 through 30. And yeah, I'll touch on that a little bit more. So Rare Across America. Rare Across America takes place every year in August during congressional recess. And congressional recess just means that your member of Congress is not in DC. They are at home in their district office. And this is a really great opportunity to meet with your member without having to come all the way to DC. So you're able to meet with your member of Congress at their district office. Like I said, Rare Across America is coming very soon. When I'm done, I'll put the link to the website in the chat box, and we'll be posting more updates there on that website soon. But I encourage you all to join us. We also have Rare Disease Week. This takes place at the end of February. And again, it's an opportunity to meet with your member of Congress. This time it's just in DC. Like I mentioned before, we also offer other opportunities like a legislative conference where we cover different pieces of legislation that impact the rare disease community. So you know what to talk about in your meeting with your member. We have networking opportunities, trainings, all that good stuff. So keep an eye out for this. And then YAR. So YAR is our young adult representatives of RDLA. Again, 16 to 30-year-old adults who are really just committed to doing work to change legislation that impacts the rare disease community. These young adults are all so fabulous. So this is a great opportunity for anyone out there in that age range to get involved. There's lots of professional development opportunities for our members of YAR. So this is a fantastic opportunity. And while I've only talked about federal advocacy, state advocacy is also very important. The state that you live in can really determine the type and quality of care that you receive. Many healthcare regulations and bills that impact the rare disease community are made at the state level. You can see some examples here. And state community action and legislative action has the potential to really improve healthcare delivery for the rare disease community in the area that you live in. This can be done through state organizations, rare disease state legislative caucuses, or rare disease advisory councils. And we offer, of course, some ways to help you out with that. We work with advocates to help create and share about state organizations, caucuses, and advisory councils. We have lots of community resources on our website. There's individual state pages that tells you about all of the different state organizations that you could join. We share about how to take legislative action. And you can also hear from other advocates who are leading in state advocacy efforts. This is just one example of some of the resources that we offer. These are 2 tip sheets, one on how to start a state-based organization and another on the difference between state caucuses and advisory councils. And we have it shouldn't say coming soon anymore. I should have edited that. We have now a state advocacy hub that you can visit on our website. Like I said, there's information on each state. There's tip sheets. You can share your story on there. You can send your state representatives emails. So this is a great place to get started if you are interested in starting your state advocacy journey. And like previously mentioned, we offer resources for the community. This is for both new advocates, seasoned advocates. We have a monthly newsletter that goes out with current federal policy, state policy highlights. We have free resources for the community. We update these regularly, and we have free events for the community listed on our newsletter. I will also post a link to get signed up for this in the chat once I wrap up. We also hold monthly webinars. These cover a range of different topics, but focus on federal and state legislation that impacts the community. We host rare disease congressional caucus briefings. We do 4 a year. Everyone is welcome to join those. We have action alerts. This is basically just an automated email. It's already written out for you. You just put your name and your address, and it goes straight to your member of Congress. We have these on all kinds of different topics, all kinds of different pieces of legislation. And we also have legislative scorecards. So you can go to these scorecards and see how your member of Congress has voted on legislation that impacts the community throughout the year. We update these 2 times a year. So that's also a great resource, especially before you go into a meeting with your member. And we also have advocacy resources such as tip sheets on various topics and policy primers on federal legislation that impacts the community. And all of these resources can be found at rareadvocates.org. I know that was a lot of information. So if you have any questions, please, my email is the first one listed here. Please feel free to reach out to me. If you're interested in the young adult program that I mentioned, Lindsay Cundiff is a fantastic resource. Her email is listed here. If you're interested in state advocacy, I've also listed my colleague who does our state advocacy work, Rachel. Again, fantastic resource. So please feel free to reach out to any of us if you have any questions about anything that was just in my presentation. And thank you, Frank, for having me.
Thank you, Katelyn. I do appreciate you having you here and having RDLA here. I can personally speak for many of us, if not all of us on here, that RDLA is a great organization and resource for any kind of government advocacy. So please do look them up as well. So I'm going to pass this next one over to Sarah Tompkins. She's going to talk about federal advocating, why it's so important. Ready, Sarah?
Yes. Thank you so much, Frank. Hi, I'm Sarah Tompkins. I'm an Ehlers-Danlos syndrome, dysautonomia syndrome, gastroparesis syndrome, and more rare disease patient and advocate. I am also the current Miss Wheelchair Washington USA 2022. And Katelyn has done such an an incredible job of describing exactly why I have been so successful in my federal advocacy. Since 2017, RDLA has provided incredible resources and really opened the door for my educational foundation of how to be an advocate. But really, federal advocacy is so important because, as Katelyn mentioned, we're putting faces to legislation and policy that's impacting the rare disease communities. And it's so important to bring those personal stories to the table. When I first met Representative Adam Smith, he explained that he had no experience really on rare disease, was not knowledgeable, certainly on my condition, Ehlers-Danlos syndrome or connective tissue disease. And yet when we ended up speaking about some of my treatments and a recent hip surgery I had had, we found out we shared a hip surgeon in common. And of all things, that really bonded us. And ever since, he has been a staunch supporter of all of the legislation and policy, even joining the Rare Disease Caucus. And so along with that, that has been an experience that really taught me that there are going to be these amazing connections. And sometimes you might not certainly feel like you connect to legislation or policy in that moment. But I will say that I have advocated for the orphan drug tax credit. And in doing so, at the time, there was no drug for my patient population that would impact them. But just since the end of 2021, the FDA gave orphan drug designation to a drug to treat vascular Ehlers-Danlos syndrome, which has some of the more fatal symptoms due to aortic and other vascular rupture and dissection. And so this is an incredible achievement, knowing that this medication for vascular EDS is really in large part coming to be because of the orphan drug tax credit. And yet I advocated for it, not really knowing that at the time. And so you really don't know in sharing your story how you're going to impact others and how that's going to be received and what that leads to down the road in terms of awareness, education, research, and such development in finding treatments and cures for these rare diseases and other conditions. What has been so valuable in my advocacy is that I've learned that there's really no wrong way to advocate. Some of my best practice moments for advocating, even in federal moments, has been just explaining federal advocacy to my nurses and practitioner and caregivers as a practice. And if I can explain it to them, that gives me the confidence to go into my legislators and policymakers and really explain that the core essential why this legislation or policy would have impacted me differently had it been in place. And being able to give a face to that and being able to be a resource for them whenever a rare disease policy or legislation comes on their table, knowing that they have someone in mind to think of and knowing that it's not just the patient, it's the patient's family, their communities, their loved ones, everyone who's impacted. And by you advocating on a federal level in government, you are making such a huge impact that even though it might not feel direct, it is. It's hugely direct. And not only that, it's so meaningful and purposeful because when you're advocating for yourself and your patient community, really you're advocating for the rare disease community at large and so many other medical communities in that same breath. And so that's what's so invaluable is that by being the advocates we can be, we're not only bettering ourselves, but hopefully bettering the medical system for those that come behind us and helping them get diagnoses, treatments, and cures faster. Thank you so much for your advocacy. We really appreciate you coming today. And I hope that you'll join us in federal advocacy and especially with the resources that RDLA has provided because they have been the backbone and education of my advocacy. And there's no better way to get started. Thank you so much for attending today. And thank you so much, Frank, for having me.
Thank you, Sarah. I do appreciate having you here today. I'm going to pass it over to Sarita Edwards. Okay, and she's going to explain how you get started and tips on how patients and caregivers can get started, even from their homes. And okay, all yours, Sarita.
Thank you so much, Frank. So I am Sarita Edwards. Good evening to everyone. I am the CEO and president at the EveryLife Foundation, and I'm also a parent advocate. And one of my tasks this evening is to share a little bit about our story and our journey and how we got started in advocacy and public policy, and then share a couple of ways that you can too. So back in 2016, my husband Kareem and I, we learned that we were pregnant with our 5th child. Around 22 weeks, we learned that our unborn child had a rare disease called Edwards syndrome, or trisomy 18. We were told that he would pass away in utero during the delivery process or shortly after birth. Trisomy 18 is when there is a third 18th chromosome on some or all of your cells. Our son Elijah has full trisomy 18, which means he has a third copy of that 18th chromosome on every cell in his body. There is no cure or treatment, and statistically, only 5 to 10% of infants born with trisomy 18 will live past their first birthday. It causes severe intellectual disability. It affects every organ in your body. We were told that Elijah was missing 3/4 of his brain. His esophagus was offline and detached, that one of the valves in his heart was not connected properly, which would only worsen after he was outside of the womb. We was told that he had liver issues, kidney issues, intestinal and stomach problems, you name it, and our son had it. And all of these were just the internal issues. On the external, on the surface, we were told that he had bilateral cleft lip and palate, low set ears, clenched hands, rocker bottom feet, and that a portion of his stomach would probably be on the outside of his body. Around 30 weeks pregnant, our OB locally decided that we needed to transition to another facility. That facility was 2 hours away, one direction. We commuted 8 weeks, sometimes once a week, sometimes twice a week. Elijah was born at 39 weeks via induction. Due to the high mortality rate associated with trisomy 18 and the life-limiting expectancy of babies born with it, medical resources were withheld from us. We did not receive newborn screening. We were refused treatment for simple things like jaundice. We were refused treatment for more complex things like chronic liver and kidney disease. We were sent home post-delivery on hospice, where we stayed for 6.5 months of Elijah's life. Repeatedly, we were told, enjoy your time with him. He will probably pass away soon. Today, Elijah is 5 years old. He has an extensive list of medical complexities. We are still uncovering new diagnoses even today. We have about 18 physicians and specialists who are willing to treat us. We have to commute 2 hours one way to see them, but he's alive. And that's what started my efforts of advocacy and public policy. Advocacy for me, it started when we received a diagnosis and our only option was to let our son die. That was not acceptable to us. We decided to start a foundation, the EveryLife Foundation, with hopes of bridging the gap between diagnosis, delivery, and coordination of care. We wanted to better support families on this journey who may be experiencing similar situations and similar treatment. We were told to find a support group without any direction on how to do so. We wanted to change the medical perspective about healthcare and how healthcare professionals view trisomy 18 when they see it documented. We chose to start a foundation because we didn't find anything or anyone that was purposefully trying to change the narrative around this diagnosis. We are a 501c3 healthcare advocacy organization. We currently offer 3 programs to support the families and the patient communities that we serve. We have health literacy, patient advocacy, comfort care, end-of-life solutions, and an economic assistance program offering financial support. For anyone interested in advocacy, whether you are newly diagnosed or you have been on this journey for some time, I would say start with looking for a disease affiliate organization and see if their goals match the goals that you have for you and your health. In our case, our child's health, and if they do, connect with them and see how you can get involved. It could be peer support to another family experiencing the same diagnosis, or you can be support for one of the programs that they currently have. If you don't find an organization that aligns with your goals and your interests, or if there isn't an organization out there, consider starting one. That's advocacy. You can do it as an individual, or you can corral a group of patients with the same or similar diagnosis as yours, and take on that project, that journey together. If you're interested in legislative advocacy, you've heard already, you can connect with organizations like the EveryLife Foundation for Rare Diseases and RDLA. Those are the organizations that helped us get started in the legislative space. They can create opportunities for you to speak with your members of Congress about policies and initiatives that can optimize the care that rare disease patients deserve and need. And you can do all of this from the comfort of your home. Super, super simple. I think Frank mentioned in his introduction, you can send emails, you can call on the phone. It doesn't have to be overwhelming, and you can advocate at your level. You don't have to do one way or another. You choose what's best for you. So I hope this helps. Please feel free to reach out to me if I can ever be of assistance. In any way, you can connect with us on social media. I'm also happy to share my email address. You can contact Frank, and he is more than welcome to share that with you. Thank you so much for the opportunity to share, and thank you so much to Frank for letting me be a part of tonight's conversation. Thank you.
Thank you, Sarita. I do appreciate having you here. And the next person that's going to speak is actually Taylor Kane. I'm going to talk a little bit more about the young adults in rare disease community being involved in government advocacy. Okay, Taylor, it's all yours.
Hi, everyone. As Frank said, my name is Taylor, and I'm joining you today to talk a little bit about my experience with advocating for rare diseases as a young adult, and also giving some tips and advice if you are a young adult, or if you do have a young adult in your life that wants to be more involved with advocacy, how you can take those first steps. My dad was diagnosed with a rare X-linked disease called adrenoleukodystrophy, or ALD for short, in 2001 when I was 3 years old. Since ALD is an X-linked disease, that means it's carried on the X chromosome, and that any male with an X-linked disease will pass that condition down to any daughters. So he found out at the same time that I was a genetic carrier. I won't be going into this a ton here, but back then we were told I didn't have to worry about my carrier status until I eventually went on to have children. I do have a 50% chance of passing down ALD, but now, all these years later, we know that carriers are also at very high risk of developing symptoms as well. My dad passed away 2 years later. ALD is a neurological condition that affects the white matter in the brain. So basically, it affects all systems of the body and basically causes the body to shut down. 2 out of 3 males with ALD will develop symptoms in boyhood, usually between the ages of 5 and 10. And still today, ALD has no treatment. The main intervention is a stem cell transplant, and that can only be done if the disease is diagnosed early, before symptoms develop. And as we know, with many rare diseases, that often doesn't happen. I really started advocacy as a whole in kindergarten. I obviously didn't know what I was doing was advocacy, but that's when I started speaking about losing my dad and telling people about ALD. And I got involved in legislative advocacy in particular, first at the state level in my home state of New Jersey. As I mentioned, ALD, a stem cell transplant needs to be done before symptoms develop. And ALD is a metabolic disease, which makes it a perfect candidate for newborn screening. Newborn screening is done to all babies in the hospital. It's an opt-out program. So they're tested for many different diseases that require an early intervention. Every state is different. And as Katelyn mentioned, newborn screening is largely one of the main public health programs that is different in every state. But when I found out that a newborn screening test was developed for ALD when I was 13, my mom kind of explained to me what that really meant and how this could have such a big implication for boys with ALD in the state of New Jersey. So at the time, I wrote a letter to my state senator, just telling him about this test, pointing him to the resources, telling him about my dad and other boys at that time that I had met with ALD. And they actually ended up introducing the bill And New Jersey was the first state in the country to introduce a bill for ALD newborn screening. And that was passed in 2013. And now, almost 10 years later, almost 40 states in the US screen for ALD. And at the time, I guess when I was doing this and writing a letter, I also testified a couple times in my state. I still never really thought what I was doing was advocacy. I guess it just seemed to come more naturally to me. And I also never really thought much about my age. I didn't see it as a deterrent at all, really. I feel like I always just came back to the quote of, if not me, who, and if not now, when. Obviously, since I was so young, I had to have a lot of help by my mom, babysitters. Obviously, I couldn't drive myself to testify in Trenton when I was 14 or 15. So I had to have a lot of help from my family. And I also got involved in federal advocacy when I testified twice for ALD to be added to the RUSP, or the Recommended Uniform Screening Panel, which it was added to, I think, in 2014 or 2015. In high school, my mom came across the EveryLife Foundation and Rare Disease Week on Capitol Hill. So I attended that for the first time. And that was really I guess, the moment when I realized that the rare disease community was so much bigger than what I thought. I always knew of ALD, but I did not know that there were so many other rare diseases and that there was these overarching legislative issues that affected our entire community as a whole. So from that experience, I was involved in Rare Disease Week now a few different years, and also ended up co-founding YAR, which is the young adult organization that Katelyn mentioned, alongside 2 other young adult rare disease advocates. And now I still, even though I largely focus on advocacy for excellent carriers like myself, I still do involve myself in advocacy and legislative advocacy. And I'm working with my state senator in New Jersey on a bill that would require insurance companies to cover IVF with PGT for genetic carriers of severe diseases. So, but really, I'm here to talk more about how to get started. I know that sounds like a lot, and I think people think I'm a lot busier than I actually am, but a lot of our speakers have alluded to the fact that doing legislative advocacy can be a lot simpler and a lot easier than some people might think. Our Congress people at the state level, at the federal level, they're here to serve us as their constituents. And so it's important that we go to them and tell them what we need. I think the first way to get started advocacy as a young adult really is to don't think that you're too young to make a difference. I think in today's age, we know that that's not true. We've seen incredible young advocates, advocates, high school advocates for gun legislation, gun control, and that they've made these such big waves. So I think we all know, go without saying, that no one's too young to make a difference. But I think it's important to know that and just take yourself seriously, and other people will as well. I think when you are meeting with, say, Congress people or emailing, calling on the phone, I think they're really used to meeting with older adults. Obviously, a lot of the people they work with are more older adults. You have to be 30 something to even run for that level. So they're usually talking to people who are in their 40s, 50s, 60s. So I think that a young voice can be really refreshing to these people. And we also, as young adults in the rare disease community, we face specific issues that, people in other stages of life might not necessarily face, which is why it's important that we're making sure that our voices are involved in the legislative process. So a big tip that I have is to stay updated on important legislation. Katelyn mentioned you can sign up for EveryLife newsletters, but when coming into the rare disease community and learning about the Orphan Drug Act, I had no idea what that was. So it obviously was a really big learning curve. And of course, there's still things about legislation that we'll never fully understand. It can be quite complicated, but if we know, the main purposes of a bill and how it's going to help our community, I think that's what really matters. So EveryLife makes it really easy to stay updated and not be overwhelmed with reading through pages and pages of bills. It's also important to make a connection to realize when your story may help play a role in a specific piece of legislation. So whenever I participate in Rare Disease Week, I always volunteer to talk about the Newborn Screening Reauthorization Act, just since the condition that has affected my life is really closely linked to newborn screening. Connecting with other advocates, of course, learning from people who have been doing legislative advocacy is always really helpful. Utilizing social media and resources that the RDLA sends out. Something else, and I don't know if this is the best way to word it, but I'll also tell people that social media can be used to apply a certain amount of public pressure to legislators. There was a delay on newborn screening in New Jersey after the bill was passed. And so I just started tweeting at the Department of Health because they wouldn't answer my emails. And after I tweeted at them, they called me back. So I feel like because, I was publicly saying like, I'm trying to get in touch with you about this legislation that was passed. And when I put that on a public platform, I think that they wanted to, kind of resolve that with me. I obviously didn't really call them out. I just wanted to make sure that they were, making sure my voice was heard. And then they did reach back out to me. So I do think that social media can kind of help with that. Lastly, use your age to your advantage. Young people, and especially people in Generation Z, which is the generation that I'm a part of, we know social media a lot better than everyone else does. Like, that's just the fact of the matter. It comes more naturally to us. We've grown up being on social media. And I think that it's easy for us to just learn how to use social media as a platform to use our voices for the issues that we care about. So I think social media will be your best friend in advocacy if you're a young adult. And last but not least, and our speakers have also mentioned this, but you don't need to recreate the wheel. Like, there are great organizations that are out there doing this work. RDLA obviously is a major one of them, but they have so many things to get involved in. So, it would be a lot more difficult just calling up your congressperson and be like, I want a meeting, when RDLA can facilitate those meetings for you. So definitely take advantage of that. I know that that's made a huge difference in my life, and I'm excited to always keep advocating. And last but not least, remember that even if you are new, even if you are young, that your contribution is really valuable. And just never forget that, because we need young voices in, every aspect of advocacy and on every issue. So yeah, that's pretty much it. Thank you.
Thank you, Taylor. I do also agree. We definitely need the young voices. If you don't know, 50% of all people with rare diseases are children. And then, so, we need those voices, people to speak for the children and that understand it more as well. Excuse me. So I'm going to pass this over to Ella Bellassa, going to basically how to empower patients and caregivers to be advocates. Okay, Ella, it's all yours.
Yeah, hi everyone, and thanks for having me on this panel, Frank. And all the speakers so far have done an incredible job in, explaining what federal advocacy is and how one can get involved. So I'm just going to share my journey to advocacy with you all today, and hopefully inspire some others to pursue their own advocacy efforts. As Frank said, my name is Ella Bellassa, and I am someone living with cystic fibrosis, and I was diagnosed at 1 year old. It is a progressive genetic lung disease that's characterized by the buildup of thick mucus in the lungs that causes inflammation and infection, requiring lifelong treatment with antibiotics. And over time, these infections deteriorate lung tissue and then lead to a shortened life expectancy due to lung failure. Over the course of my life, I've had countless hospitalizations requiring intravenous antibiotics, and daily I have to do 4 inhaled breathing treatments a day to clear the mucus from my lungs to be able to breathe. And I've always had an interest in science, but I never wanted to study medicine in school because of these many health encounters that I've had throughout my life and as a child in the hospital. But after in college, I received a degree in biology, and then I worked in an environmental microbiology lab. after college. And so this is about the time that I started my advocacy journey. Like I said, working in that lab had overlap with my health because I was looking at analyzing antibiotic resistant bacteria in environmental samples. And I became interested in how the public is educated on these matters, and then more specifically, how patients uptake health information and the value that there is in, understanding our own disease and our own, health pretty much. So then I started lending my voice, my patient perspective into research. So my background certainly helped in me understanding, clinical trial protocols and the science of new therapies and how drugs interact with the body. And, because of that, I had a number of opportunities to serve on committees, first with the CF Foundation, and then on advisory boards as well, doing like clinical trial protocol reviews and, writing lay clinical trial summaries and things like that. And then in 2019, I became very sick with an infection in my lungs that was not being treated by antibiotics any longer because of antibiotic resistance. So, many of the traditional antibiotics that I'd used throughout my life were no longer effective against, treating this terrible infection. So I resorted to trying an experimental therapy. And I pursued this directly with researchers at Yale, really without the help of my cystic fibrosis physician. And this was really a difficult and terrifying experience to have to navigate this process and, weigh the risk and the benefit of trying a new therapy that hasn't been tested in more than, a dozen or so people. Ended up being successful. And it made me realize the value of advocating, self-advocating in this example. And after this, I really wanted to encourage other patients to take active roles in their healthcare and impact our own, how much our involvement has an impact on our health outcomes. So I wanted to raise awareness about this particular treatment as an alternative to antibiotics. And so I shared about this experience all over the internet. I published my story in the HuffPost, and I realized the power of, as Taylor said, the power of social media and how much it can be, utilized to project our voices. So I began writing my experience, my healthcare experience, and submitting it and sending it to various patient advocacy organizations. And I think that there is so much power, collective power in us as patients coming together and talking about treatments and research and things that aren't working in healthcare and where changes need to be made. And I think this really grabs attention from policymakers and industry and advocacy organizations. So that's what happened. So after I started sharing this experience and the story, then it became sort of a face to the problem of antibiotic resistance and the patient experience and this particular therapy that I tried. There are so many hurdles and healthcare problems that exist, and we can humanize these challenges, and it helps to move the healthcare industry and improve health outcomes. So we're by advocating and sharing our experiences, we're inspiring innovation and spurring efforts to make changes into healthcare. So from there, I was asked to then speak at conferences and meetings, sharing about my experiences. And then I spoke on panels at the Milken Institute and the FDA for Rare Disease Day, and at congressional meetings too with, I live in Virginia, so with Virginia legislators and nonprofits like with the Cystic Fibrosis Foundation, and also like the Presidential Advisory Council on Antibiotic Resistance, the Infectious Disease Society of America, among others. But many of these meetings were obviously sharing my patient experience and in support of like the PASTEUR Act or incentivizing, which is is targeted to incentivize industry to develop novel antibiotics against antibiotic resistance, and what the the problem globally that can be. So I had taken it upon myself to learn so much about this area, and I could really hold my own with communicating with researchers, with industry professionals, and I was able to educate policymakers about the devastation that is antibiotic resistance for the global population, not just those with cystic fibrosis. So I think, gaining considerable knowledge about, the disease area that we're passionate about is really important to becoming a strong advocate. I think advocacy means being passionate about, going lengths to bring awareness to a cause that, it requires us to yearn for more information and understand more about our conditions, that we can make these, we can help identify the barriers and obstacles that occur when we're not getting the optimal treatment. So, and these obstacles really, I think, fuel our passion. So it's kind of a cycle. And I think it's important for us to, like I did, take stock in the knowledge that we have about our lived experience and our conditions. And this allows us to feel confident in, voicing our thoughts and opinions about the healthcare system, and, providing suggestions on how it can be improved and what patient needs are. And, I think being even if for those that are beginning their advocacy efforts and sharing their story for the first time, I think it's really important to not be afraid or, held back by the fear that, you don't know enough. I think that, we have to take stock in the knowledge that we have about our lived experience and about our condition, and how we've dealt with that and overcome these obstacles, and use that to elicit changes in, healthcare policy and, insurance obstacles and access and affordability. So some of the other panelists had mentioned this, but to expand on my advocacy knowledge, I've participated in RDLA webinars and YAR, and Patient Rising has a masterclass. That's another, a really good opportunity to learn about how to share your story and ways to become involved in legislative advocacy. And I think that brings me kind of to my last point, is that, advocacy is really a multi-stakeholder effort. There are so many resources, patient organizations, policy organizations that support patients through advocacy, and reach out to them because the resources are there. I think we all know how important that is, and being involved in any of these organizations are going to help you through that and help you become stronger advocates. And I now speak publicly on topics more broadly, not just antibiotic resistance, but really the value of patients and research in general, and how we can move the needle on some of these policy changes that will help, like I said, better access and affordability for patients, getting new treatments and getting involved in new trials and things. I really want my voice to be heard by those who need to hear it. So that's really one of my advocacy goals, is just to inspire other patients to begin their advocacy journeys, and that it can really, as other panelists said, it can really start from your home. You really don't have to have any experience in this. It kind of just snowballs, when you get your story out there, when you get your voice out there, people are listening, and you're invited to share even more, and you are inspiring, and you're moving, and you're eliciting changes and improvements into our healthcare system. So thank you for having me on this panel, and I'm looking forward to the conversation after this.
Thank you, Ella. Before we go into the Q&A. I actually I wasn't going to say much, but I did have a couple of things I did want to say. I guess I always have to say something. First off, I wanted to thank everybody who's on the panel here. We have 5 great advocates. Couple of things I just wanted to, there's some reasons why I thought about doing this, and there's why I wanted to let this, separate we're rare, but together we're strong. Okay, when there are 30 million people, over 30 million people who have rare diseases, that's more than a lot of a lot of other diseases put together. All right, so that's the reason why I didn't just do a disease specific. And another reason why I didn't do a disease specific is that you don't know until you actually speak to other people who have different rare diseases and find out that we have a lot of the same common goals. Only 5% of rare diseases have a cure. So that's a lot of people, a lot of diseases that don't have cures. And so if we work together, I'm very big on collaborating. If you work together, we can really make things happen. Rare Disease Week is, I mean, to me, well, I'm dating myself now. This was my 7th one that I've been at. I actually missed 2, but yeah, so it's my 7th one that I've been at, and it means a lot. And a lot of people also don't see that, or like if you go into your room and like, this is one of the things I always pass out because I'm in New York, so I am in a large group of advocates. And just because there are 30 people speaking to the senator, don't worry about that. This is a good way to get yourself in the door, because they will know who you are the next time you go out and reach out to them. Now, if you can't go to a Rare Disease Day or Rare Disease Week or something like that, write your story out and send your story. You don't have to do anything else, but just send your story. That alone will make an impact on your legislators, your senators, and even when it comes to state and even county and towns and all that as well. But I really believe that from home, there are so much that you guys can do. You can call, you can email. All right, everybody always says we want a cure, but I always go back and ask everybody, what are you doing about it? Okay, and I'm not saying that to be mean. I'm just saying that there are things you can do. And if you ask, if you ask any one of us 6 on this panel, we will help you. I could tell you that. I know each and every one of us will help you and will want to help you. So don't be afraid, to ask for help. Just also so you guys know, this is being recorded, and I will send it out to everybody that signed up. And I will also put it in on my our Facebook page, and I'll send it to everybody else so they can, the panelists, so they can also share it as well. All right, and so I'm gonna go over to the Q&As now. There are a couple here that I really thought that I'd like to ask, and I'm gonna kind of do it as a roundtable. Some are specific that I probably will ask individual, but there's others that anybody can answer. The first question I have here is, are there advocacy activities that you engage in routinely to ensure you're always contributing? For example, weekly, monthly letters to legislators, regular event attendance to stay consistently active. I'm going to just say that there are some that are more active than others, and just because you're not as active as others, you have to work, first of all, do self-care. Self-care comes first. That's the first thing I'm going to tell everyone. Anybody want to answer? Anybody have?
Yeah, Yeah, I totally agree. I think, advocacy burnout is definitely real. I'm sure we've all experienced it, but there definitely are like small things that I do consistently that literally take less than 5 minutes. So one, for example, I run an organization called Remember the Girls, and we're part of EveryLife Foundation's Community Congress. So a few times a month, we'll get emailed a sign-on letter to sign on as an organization in support of a certain piece of legislation. They send a Google form. So I literally have to fill out my name, email, and make sure that I'm the verified person for the organization, to add us to the letter, which I am. And it literally takes 2 minutes. So anytime I get those emails, I always do them because, I want that list of organizations to be as long as they can make it. And, it's so easy. So that's one that I always do. And I'm so appreciative that the EveryLife Foundation makes it so easy. Yeah, I really enjoy those.
And Sarah, I saw that your hand was up.
Yes, Frank and Taylor, thank you guys for mentioning self-care, because I think that's a big part of it. Because the reality is, as patients or caregivers, sometimes we aren't able to dedicate all of our time to advocacy. The reality, our health comes up, issues comes up that we can't predict. And it's very important to show that that's a reality. And it's even an opportunity really for you to follow up and say, I wasn't able to do such and such or attend this way, but message them or send a note in the mail, because those, even though they take a little longer to get to them, they are still meaningful and impactful. And by you sharing your story, you're advocating for others and yourself and your patient community and the rare disease community. And so it's so important that we take care of ourselves. Actually, my Miss Wheelchair Washington USA platform is practice self-care for your healthcare, because I truly believe that advocacy is a part of my self-care. But to be the best advocate, that involves having pacing and being able to say no, and being able to balance it, being a full-time patient with a patient advocate. And while it's a difficult dance, it's really important that we all prioritize our health so that we can be the most effective advocates we can.
I just wanted to
Anybody else?
chime. Oh, sorry,
ahead.
Frank.
Go ahead.
I was just going to say too, I think one of the ways that I try to stay active, kind of like Taylor was just saying, I watch for emails to see, where there are opportunities that I can just kind of respond that way. But then too, you have Rare Across America and Rare Disease Week. Those are opportunities, they're consistent. So because they are annual events, I have made connections with staffers in the offices of our Congress members, and you build those relationships, kind of like what Ella was saying, and I think somebody said in the chat box. So you build those relationships, and I've even gone so far to invite one of our members of Congress to a gala that we were hosting, and we've received confirmation that he and his wife were going to attend. Of course, that was March 2020 and COVID hit, so we had to cancel the gala and his ability to participate. But I think all of that just really stemmed from building those relationships, and you do get to where after you continually do those things, you recognize the names and they remember you and your story a little bit. I think too, another way, in terms of just being active is in addition to getting those sign-on letters of support, sometimes we get information about legislation, and those are opportunities to send emails to those staffers and just remind them that you're there. So again, it's that 5 minutes that Taylor was just talking about. But then in the self-care aspect, you can just not respond if you don't want to, or if it's not a good time. So it's really the ball is in your court every single time. You decide what your bandwidth is, and you support what you're able to do. So, but those are the ways that I try to stay active.
I also just sort of want that we talked about earlier is don't forget about social media. If you tag your representative or your senator, odds are they're going to see it. Somebody's going to see it in their office. and it'll be brought up to them. So don't be afraid to tag them on Twitter, on Facebook, on Instagram, and for those of you who could do TikTok, you could try that too. But yeah, so that's another way, and that takes a minute, 2 minutes. If you get if you find something, an article, you want to tag them in an article, just share the article, something like that. That's just something really easy, and it doesn't take much effort or time. Anybody else had any other answers to that question, or should I go on to the next? Well, I guess I'll go on to the next. All right, this one actually, Katelyn, is going towards you. Does RDLA have any open position volunteer work, kind of?
Yeah, so anyone is eligible to volunteer with us. I mean, that includes coming to webinars, showing up for Rare Across America and Rare Disease Week. And there are other opportunities within those events. So, Sarita and Sarah, for example, serve as team coordinators when we have and Frank serve as our team coordinators for Rare Disease Week and Rare Across America. So, because they've done this with us so many times, they lead their state's meetings with their federal representatives. So there are a lot of opportunities to get involved. Yeah, it doesn't matter what your experience level is, there are opportunities for everyone.
Thank you, Katelyn. All right, so I'm going to go to the next one. Is how has advocacy changed for each of you in the era of social media? Who wants to go first?
I guess I could start out.
Go ahead, Ellen.
Yeah, I would say that it's obviously it's made it a lot easier, as you were saying, Frank. Like it doesn't take very long to just put a little post out or share a story, on Instagram, or put out a little blurb on something that you're advocating for, a policy that you want enacted or changed. And so I think that it allows for more people to see what you're posting, to see what you're advocating for, and to learn about it, and to get resources, and to feel empowered too, to do it themselves, because I think they can, it's easy because they can see how easy it is to post something or to reshare something. So, I think it's only just exponentially, increased, first of all, the breadth of, who is able to access or see this information, and these changes, and then also, just enabled people to do it themselves.
I agree with Ella. I think social media has been, especially, with COVID, I think just social media and the virtual space has really grown for people to communicate with each other. I know when it comes to advocacy, specifically for me, I use social media to share pieces of our story, kind of like what Ella was just describing. Is an opportunity to raise awareness about our disease, trisomy 18, but then it's also an opportunity for us to show something different compared to the medical statistics. So it creates that interest of, how does this kid have the exact same diagnosis, but he's doing this or doing that. And so it really heightens the awareness and the interest from just other stakeholders within the community, but also genetic counselors and practitioners. They reach out and they want to know different things about your journey. I think too, when it comes to just networking and collaborating with other organizations, a lot of times they provide toolkits. And so that makes sharing on social media really, really easy because you have the graphic, and a lot of times you have the information and you just put it together on your social platform. So I think collaborating is one benefit too, when it comes to using social media, because a lot of times those organizations that are trying to push that information, they share with you the information. You just, you put your own little twist on it if you want to, and add your own little language that represents how you would say it. But just collaboration and raising awareness, I think, have been social media has really grown that for us as an organization and as a family living with Rare.
Another angle that I was thinking about is social media. It's hard for me to imagine like what it was like to be diagnosed with a rare disease or have a rare disease before social media. When my dad was diagnosed, of course, that was before Facebook and everything. And I just can't imagine what that was like for my mom and my dad, not being able to turn to social media and find a support group. But I do think that social media support groups, specifically Facebook groups, have allowed advocacy and legislative advocacy to really flourish within conditioned communities specifically. In the ALD community, for example, as I mentioned, over the last 10 years, ALD has now been passed newborn screening in about 40 states. And so much of that I've seen happening in front of my own eyes, starting within Facebook groups. Like someone will say, oh, I'm from Iowa and I realized ALD isn't on the newborn screening panel. Like, can someone give me advice for what you did to get it on your state's panel? And then the other ALD advocates will, come right to their assistance and do whatever they can to help this person approach their legislator and talk about ALD newborn screening. And I just think, without the internet, but even without social media, like trying to coordinate things like this over email even is just so much more difficult. But being able to do it in a Facebook group, Facebook Messenger, like it just makes it so much easier. And I really don't think that, I of course can't speak for newborn screening for other conditions, but I think that if it wasn't for Facebook, that ALD newborn screening would have not spread across the country as fast as it has, because Facebook is where our community has mobilized so much.
Yeah, I totally agree with you, Taylor. The one thing I was going to say for Sarita also is please share others when they are, especially, when they're putting something out there about their disease. Like I talked about earlier about collaborating, that is something easy to collaborate on. Just share it, retweet it, share it on Facebook. The more times it gets put out there and shared, the more it's going to be seen, and the more, it's going to help. Like I said, we all are here to help each other. It's not us trying to get a cure before somebody else. If somebody gets a cure, you know what? We all should be happy. And that's the way it always should be. All right. So with that, I'm going to go to the next one. And I am going to start with the answer on this one because I really like this question. How have you handled frustration or disappointment when being dismissed or turned away by legislators? All right, I am going to talk about this a little bit. I am very different. A lot of people who know me know that I am very different when it comes to legislators and senators. And one way I'm not is that I don't take no for an answer. I will sit in an office until you talk to me. That's how it was funny. Senator Schumer, who is my senator, actually, when I sat in his office one day, was telling me that the other senators, and I've actually spoke to all 50 of them at one point, they have a nickname for me. It's called pain in the butt, but it's not that word, of course. But yeah, that's their nickname, but I wear it with honor. I wear that as a badge of honor because they know me, and B, they know I'm not gonna stop until you listen. So that's something in my respect. I don't, yeah, we're all gonna get frustrated. It's very hard in the climate that we're in right now. The political climate is very tough. If you're a Republican, nobody wants to sign on a Democrat bill, blah, 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 blah. But you gotta let people know that rare diseases don't care if you're Republican, Democrat, independent, conservative, it don't matter. It doesn't ask you. It's gonna happen, it'll happen. So you have to be You have to let them know that. And you have to let them know that this is a health issue. This is, this everybody, this, like I said, there's 30 million people who deal with rare diseases. When you say that number, 1 out of every 10 people have rare diseases, that impacts. All right, so you got to put your own personal, if you're a Republican, Democrat, you have to put that aside as well. And you also have to, let them know that's what we're not here for Republican, Democrat. We're here for a rare disease. So with that, I am going to pass it over to anyone else who wants to speak now.
Frank, really great answer. I think that, it's such a bipartisan issue. And when you feel like maybe you're not making that connection with a staffer or your legislator and policymaker, use that as an opportunity to use follow-up and try to make that connection, share more of your stories. Somebody had asked about sending a video to legislators. Absolutely do that. Send pictures of your patient community, send pictures of your support group, invite them to those events, invite them to everything that you can locally and on a state level and federally, because it's really about, so much of this is education and awareness. And that just comes down to the more voices that we have, the better representation of what a diverse community that we have in rare diseases and just in healthcare in general with people suffering from different conditions. And whatever cure, as Frank said, whatever cure or treatment we get for one rare disease, we are cheerleaders of that because it pushes us all forward. And we know that. And I think that this is very unique to the rare disease community and that we are such cheerleaders for each other. And that's why it's so great that there's really no wrong place to start and there's no wrong way to advocate, especially using social media. Maybe it's just sharing your day-to-day life. Maybe it's sharing an experience of another friend or support group member is going through or coverage issues. All of those things are incredibly invaluable to, especially for us to refer back to in these meetings to say, look at these issues. These are the issues of our community. And that's really impactful, tying pieces of legislation to that as well. It makes us the most effective advocates we can be.
Anybody else? Nobody else wants to touch that one? Okay, no problem. Actually, Sarah helped answer this last one, but I'm gonna just change the question a little bit. The question was, have you ever sent a legislator a video letter instead of written one? I'm gonna ask, what are some different things that people have sent? And why? Anybody wanna?
Yeah, I'll talk about a picture that I always include when I advocate at Rare Disease Week. So we have a few different pictures from when my dad was sick and he was in hospice care in our house. And there's a picture of me when I was like 3 or 4 years old. He lost the ability to swallow, so he had a feeding tube. But before then, he could eat like really soft food. So there's a picture of me feeding him. And I guess, I think the reason I choose that picture is because I know like it's one that will pull at the heartstrings. And I feel like, of course, a lot of people in our community, like it can annoy us being like, oh, you're such an inspiration. Like, we get kind of tired of hearing that, or get when people look at our stories and really pity us. But I know that if someone looks at that picture, that they will feel like emotionally compelled, which is why I choose it. So I do think that, that there is like strategic elements that you can use here. Like, pictures are so powerful, whether those be pictures that you leave behind for the legislator's office, pictures you post on social media. Also on social media, posts across any platform that have a picture perform way better engagement-wise than posts that don't. So that's always something just to keep in mind. Like the visual aspect, whether it's pictures, video, is just huge. And I think it really illustrates like what we've been through. You can say, oh, my dad was, in hospice care, but like, what do you really picture when you think that? I wouldn't know what to picture if someone said that, but when you actually see what it looks like, you can kind of understand more what that person has been through and what, the 30 million people affected by rare disease go through at all different types of levels throughout their experiences.
That's a really, really great point, Taylor. I think that's why we always choose to use Elijah's photo when he still had bilateral cleft lip and palate, because it shows an experience that we had, and it shows the severity of our push and our drive. One of the things that you said during your presentation that really stood out to me was every infant should receive newborn screening. And that is so true, which is why we support the newborn screening legislation that RDLA pushes or promotes. Because that was withheld from us. They didn't even give us an option, but that's why we choose photos when Elijah was a baby. Thankfully, we have a medical team now that's willing to see us, and his bilateral cleft lip and palate has been restored or repaired, but we still choose that photo for that reason. We want to showcase the path where we started, and then we can share where we are now. I think too, one thing that we always include, we've not done a video, but that's something that I think is a good idea for this upcoming Rare Disease Week. But one thing that we also try to make sure we include is information about the foundation, whether that's your own foundation or if it's an organization or foundation that you support as a patient. And for us, I think that's an opportunity to show, kind of like Frank was just saying, the what are you doing is showing this is what we feel was missing. And so we jumped in to try to bridge the gap between what was missing and what's available. So we try to always make sure to include photos of Elijah's journey and information about the foundation to showcase the how we're trying to contribute and why we need their support.
Thank you. Anybody else wanted to add on or no? Yes, go ahead.
This is a little different from a photo or video, but in actual in-person meetings, I will show some of my surgical scars or some of my medicational patches and say, this is what's enabling me to advocate, and not all of my patient community gets it because there's such a vast access to care difference. And that is a large motivation for me to being a patient advocate. And I think, like Taylor said, it's difficult because it's sort of a shock value. Hey, this is a snapshot of some of the most difficult stuff that I go through, but that's exactly what they need to hear. And it's a vulnerable position to be in to share that, but know that you're in the best community of people to do it with, because we all understand those issues and support each other in being the best advocates and step in for each other. So you're in really good company.
Definitely. Anybody else? All right. This next one I see Katelyn's kind of, what's the best social media platform to post on to get Congress attention? I would personally say you really have to look into what they are answering more. Some people you can go back onto their page and see that they have a Twitter account, but they haven't used it in 2 years. So you go to their Facebook, or you would go to their LinkedIn, or you go to their Instagram. Each one have their really what their media person likes. It's not even the I would say even the senator or the legislator. But there are some legislators, like my legislator, he actually posts himself a lot. So you just have to look and kind of just do a little bit of homework. It doesn't take long, but just do your homework on that. Anybody else have anything to add to that question? Go ahead.
I have something small to add, something kind of funny. So this isn't even about rare disease advocacy necessarily, but one of my senators is Cory Booker in New Jersey. And 2 years in a row, I DM'd him happy birthday on Instagram, and he responded both years on Instagram. So yeah, I was shocked by that because I didn't think that he would respond. But now I know if I need to send him something about rare disease advocacy, it's going to be on Instagram. But yeah, I would say Instagram, Twitter, maybe Facebook comments. Like, I feel like for my state senators, people will always comment stuff on Facebook, but it can kind of be hard maybe to get your comment like noticed on Facebook because people are commenting all sorts of stuff. But I do see them respond on Facebook. But yeah, I think Frank had great advice. Like, I think it depends. We know like Alexandria Ocasio-Cortez, for example, is really big on Instagram because she really appeals to the younger community and really big on Instagram. Some legislators are probably on TikTok. So yeah, just look for where they are and then go there.
And I was just gonna say too, try to find like where you can tag them. You know, I've seen on some platforms you're not able to tag. So if you're trying to push information that you want to tag them in or make sure they see, you know, play around with it a little bit to see if you're able to tag. I know I've tried to do that sometimes, and I get that message, you know, this person won't let you tag them. So like everybody else said, you know, I think you just kind of have to play with a little bit to see where that engagement is. And I think that was really good advice. Like if their account hadn't been active in a while, you may not want to waste your time on that platform. But really just, again, just try to figure out where they are most active. And if you're not active on that platform, consider creating you a profile if that's a way to reach those members of Congress that you're trying to.
Yeah, and like Sarah put in the room, also check their website. Usually they put up their social media accounts on their website, so you can go on to there as well. I have two questions that I really want to ask, but Katelyn, this one is going to go to you. I know we talk about ask a lot. Can you tell people what an ask is? You know, because a lot of people, you know, the jargon of an ask, but they don't actually know what an ask would be like. Okay.
Yeah, definitely. This is a question that we get often too, because we just use the phrase and, you know, don't explain it. But an ask is essentially the item that you, or the thing that you're asking your member of Congress to do. So a good way to think about it is, you know, you think of a problem that you have and then a solution, and your ask is that solution. So that could be joining a caucus, co-signing or co-sponsoring a piece of legislation, signing on to a letter of support. So there's all different kinds of asks that you could have, but your ask is just essentially what you want your member to do.
Thank you. Yeah, because I know I'm guilty of it. I'll just say ask and thinking everybody knows what it is. I'm like, wait a minute. Yeah. So the last question, I'm actually going to start with Sarah, and everybody else can kind of jump in. Can you talk a little bit about elevator speech and why is it so important?
Great question. Yes, elevator speech is so important. A great visual is if you were in person at the Capitol and you happen to get stuck in an elevator with your legislator, how would you present your problem, issue with your personal story to then present your ask, and how that ask would have impacted maybe a different outcome for you in the issue or experience that you had. And so it's really important to be brief, because you don't really get a lot of time with these legislators, especially as Frank said, in these bigger meetings where we have a lot of advocates. And so it's good to have a 1 minute or 90-second and 2 minute really short spiel of, hi, I live here in this district. My rare disease or disease affiliation is this. Here's my experience. It could have been so different had 21st century or Cures 2.0 been in place, or a rare disease center of excellence through STAT Act. And then you can say, and I would love to follow up with you with more information about this through email, where then you can share the one pagers that really give the detail of the information about the piece of legislation and policy. So you don't need to worry about spending that 90 seconds or 2 minutes that you have being really detailed about the policy or legislation. Leave that for the follow-up and really just try to make that connection by sharing your face and story and quickly your ask so that they know what's coming in a follow-up with you. Great question.
Thank you, Sarah. Anybody else want to add to it?
I agree with Sarah. I think the way
I just wanted to,
described-
I know I wanted to ask.
Oh, no.
I think we lost him.
Yeah.
It is 7:30 though.
Just
Yeah,
on time.
Yeah, I was just going to say really quick, I agree with what Sarah was saying. And I think too, having your pitch, your 90-second, 2-minute, it helps you know the high points of your story, but still make room for the ask. Because I think a lot of times we get so passionate and motivated about our stories. We take all the time telling our stories, and then we don't have time for the ask. And so I think having that elevator pitch, it helps you kind of leverage the opportunity to be with your members of Congress. You have a few seconds for your story, a few seconds for your ask, and then that information about, I'll follow up with you. So that's been huge for me. It helps me just pinpoint the high points of what I want to say about our journey, but then really focus on the ask and preparing them for my follow-up.
Totally agreed. Practice makes perfect, definitely. Even like writing it out, say you were going to Rare Disease Week, like type it up. Oh. Was that Frank, I think? Oh, just Zoom issues. Okay. But yeah, practicing ahead of time, typing it up, speaking it to yourself a few times. That can definitely help you feel more confident, and also prepared if you did, like Sarah said, run into an instance where maybe you're not in a sit down meeting, but maybe you are walking by like your legislator and you catch them in the hallway, and then maybe you're a little caught off guard, but like with your elevator pitch, you just feel ready to go because you know what you're going to say. Okay, I think Frank is back.
I think I'm back. Am I back?
Yeah.
Okay. And one really quick thing about the elevator pitch, and then we're going to get out of here. I know we're 1 minute into it late. Just remember, the elevator pitch is also good for any time you meet somebody. Just remember that. That's your elevator pitch. When you want to bring awareness to your disease, that 1 minute, 3 minute, 90-second, whatever it is, talking to that person is your elevator pitch. That's all I have to say about that part of it. But I do want to thank everyone, all my panelists, and everybody that, the participants and all the people that are watching. I plan on doing more of these. Like I said, this is 101, and we will try to get a little bit more in depth if you guys want to learn more about advocating. But once again, thank you. And thank everybody that is involved in this as well. And have a great night and see you soon.
Bye, everyone.
Bye-bye. Thank you.
all.
Bye.